So for today's video, umupo ako ng upuan para magpa-health assessment. Tinukot ko lang yung cellphone ko para mag-check ng mga kung ano-ano. Ayan, ready na ako. Sige sir, nurse, simulan mo na nurse. So si nurse, nagdadasal, papakilala na siya. Sumasayaw-sayaw muna. For today's video, tumingin pa nga sa camera. Dumila pa. Ayan na, dumila pa. Ayan, sisimulan namin in 5, 4, 3, 2, action. So ayun, chinecheck ko na po yung mga informations ni patient. Double check ko yung name, date of birth, address, mga history. Nag-i-interview na rin po ako ng mga basic objective and subjective data. So ayun. Hi, ako nga po pala si Nurse Ryan, student nurse for today. So ngayon for today's assessment, i-assess lang po natin yung head, neck, and throat. Okay po. So pakitanggal lang po yung salamin. Thank you sir. So first, inspect the skull of size, shape, and symmetry. Second, inspect the facial features of structures and the distribution of hair. Inspect the eyes for edema or hollowness. Note symmetry or facial movements. Ask the client to elevate the eyebrows, frown, or lower the eyebrows. Close the eyes tightly, puff the cheeks, and smile and show the teeth. Okay, so this is what it looks like. Isang eyebrow, sir. Isang eyebrow, sir. Dito. Kabila, sir. Sana, sir. Simangot, sir. Simangot. Tapos, smile, sir. Smile. Sige, sir. Tulungan naman, sir. Tapos, check ko lang kung may edema. Okay, sir. Inspect the eyebrows for hair distribution and alignment of the skin quality and movement. Inspect the eyelashes for evenness, distribution, and direction of curl. Inspect the eyelids for surface characteristics, position in reaction to the cornea. Inspect the bulbar conjunctiva over the sclera for color, texture, and the presence of lesion. Inspect the cornea. Inspect the pupils for color, shape, symmetry of size. Pupil charts are available in some agencies. Snellen chart test to assess the vision of the eye. Assess distance vision by asking the client to wear corrective lenses unless they are used for reading only. Ask the client to stand or sit 6 meters from a Snellen or character chart. Cover the eye not being tested and identify the letters of characters of the chart. Take 3 readings, right eye, left eye, and both eyes. Assess each pupil's reaction to accommodation. Assess peripheral visual fields to determine function of the retina and neuronal visual pathways to the brain and second optic cranial nerve. Hold on pen light. Extend your arm and move the object into the visual field from various points in the periphery. Inspect the auricles for color, symmetry of size, and position. To inspect position, note the level at which the superior aspect of the auricle attaches to the head in relation to the eye. Palpate the auricles. Inspect the external ear. Visualize the tympanic membrane using an otoscope. Use an otoscope to check the ear. Check both sides, left and right. Alright. Good. For ear tests, use a tuning fork to measure the air conduction and bone conduction. On this side, use the edge to measure the bone conduction. Once the sound or vibration is gone, flip the other side to measure the air conduction. So this is how it looks like. On this one, this is the Weber's test. Sound is heard in both sides ears. Inspect external nose for any deviations. Lightly palpate for external nose to determine any areas of tenderness, masses, and displacements of bone and cartilage. Determine patency of both nasal cavities. Ask the clients to close the nose. Exert pressure on one iris and breathe through. Inspect the nasal cavities using a flashlight. Inspect the outer lips for symmetry or contour, color, and texture. Inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and the presence of lesions. Inspect the teeth and gums while examining the inner lips and the buccal mucosa. Inspect the dentures. Ask the client to remove complete or partial dentures. Inspect their condition, nothing in particular broken or worn areas. Inspect the surface of the tongue for position, color, and texture. Ask the client to protrude the tongue. Inspect the neck muscles. Observe head movement. Move the head back so that the chin points upward. Assess muscle strength. Palpate the entire neck for enlarged lymph nodes. When palpating the supraclavicular nodes, have the client bend the head forward to relax the tissue of the anterior neck and to relax the shoulders so that the clavicles drop. Palpate the trachea for lateral deviation. Place your fingertip or thumb on the trachea in the suprasternal notch. Inspect the thyroid gland. Document findings in the client's record.
Put a patient in a semipolar position, then inspect and palpate the precordium for the presence of abnormal pulsations, lips or hips. Locate the bulbs areas of the heart. Inspect and palpate the apical area for pulsations, noting its specific location. If displayed laterally, record the distance between the apex and the MCL in centimeters. Inspect and palpate the epigastric area at the base of the sternum for abdominal aortic pulsations. Auscultate the heart in all four anatomic sites: aortic, pulmonic, tricuspid, and apical. Auscultation need not be limited to these areas. However, the nurse may need to move the stethoscope to find the most audible sounds for each client. Keep the client in a supine position with head elevated 15 to 45 degrees. When auscultating, concentrate on one particular sound at a time in each area. Palpate the carotid artery using extreme caution. Auscultate the carotid artery. Turn the client's head slightly away from the side being examined. Auscultate the carotid artery on one side and then the other. Listen for the presence of a bruit. If you hear a bruit, Gently palpate the artery to determine the presence of a thrill. Inspect the jugular vein for distension while the client is placed on the semipolar position. Palpate the peripheral pulses on both sides of the client's body individually.
Tapos yung brachial eh. Dito na sa biceps yan. Palpate mo.
Inspect the skin of the hands and feet for color, temperature, edema, and skin changes. Inspect the muscles for size. Compare the muscles on one side of the body to the same muscle on the other side. Test muscle strength. Compare the right side with the left side. Client, turn the head to the one side against the resistance of your hand. Repeat with the other side. Client, shrug the shoulders against the resistance of your hands. Client, holds arm up and resist while you try to push it down. Client fully extends each arm and tries to flex it while you attempt to hold arm in extension. Client flexes each arm and then tries to extend it against your attempt to keep arm in flexion. Client spreads to the fingers and resists as you attempt to push the fingers together. Client grabs your index and middle fingers while you try to pull the fingers out. Client is supine, both legs extended. Client raises one leg at a time while you attempt to hold it down. Client is supine, both legs extended. Place your hands on the lateral surface of each knee. Client spreads the legs apart against your resistance. Client is in the same position as for hip abduction. Place your hands between the knees. Client brings the legs together against your resistance. Client is supine, both knees bent. Client resists while you attempt to strengthen the knees. Client is supine, knee partially extended. Client resists while you attempt to flex the knee. Client resists while you attempt to dorsiflex the foot and again resists while you attempt to flex the foot.